This is Jane. Jane is an unregulated, self-employed private support worker who works with children, youth, and adults with developmental disabilities. Since Jane doesn't work for an agency, she finds it hard to network and connect with other support workers. Sometimes Jane has a situation she would like to talk to a mentor about, but she doesn't have one. She also isn't quite sure how to be self-employed. Although she wants to make sure she's doing her best in meeting the needs of the people who hire her, sometimes she doesn't know if she's providing the best care and doesn't know how to provide more training or mentoring. Sometimes she feels like quitting because she has no support. She does love the people that she works with, though. Jane doesn't know it, but there are many other people doing the same thing and feeling isolated in their work and confused about how to be self-employed. I wonder if Jane knows that in 2015 there were an estimated 65,000 adults with developmental disabilities in Ontario, and more than 15,000 were supported through the Passport Direct Funding program at the time. The Special Services at Home program served more than 12,500 children with developmental and physical disabilities at that time as well. We know these numbers have increased since then, and so have the private support workers who are hired with this money. That doesn't even include the approximate 150,000 adults with physical disabilities, many of them who are over 65 and also hire private support workers. Some of the private support workers are casually self-employed while also working for a formal agency, or, like Jane, self-employment may be their only means of income. That means a lot of self-employed, unregulated, and isolated private support workers like Jane are out there feeling alone and not sure if they're providing good quality supports and just good practice. Jane just heard from one family that many of their friends haven't been able to find any support workers, and COVID-19 has made it worse. The Ontario government funds the individualized funding, but there's no support to help Jane and others provide the services that the funding pays for. What if we could help Jane and the families? What if we could provide Jane and others with ongoing professional development and networking opportunities for those workers that would increase their competency and where they could further develop leadership skills while being mentored? What if we could improve the quality of unregulated services and supports for people who receive individualized funding from health and developmental services, while at the same time building a more just and sustainable workforce in this area? What if families could search a directory of workers and occasionally connect with them through biannual network gatherings in order to identify potential workers like Jane, while informally interviewing those they may want to hire? The impacts would be that Jane and others would feel more supported and less isolated. She would have increased professional development and support as a self-employed private support worker. It would help Jane feel like she had the resources to provide increased quality of services and consistency for people receiving individualized funding, and it would increase retention and workforce stability. It's time to tell Jane about our idea of Just Good Practice. Just Good Practice is a community practice network throughout Ontario for self-employed private support workers like Jane, and it has a website, directory of members, links to professional development videos, as well as tools and resources about self-employment. Each member pays a small membership fee and is matched with a mentor according to their identified goals in development and leadership. Monthly in-person or virtual networking events are held to foster development of best practices and peer supervision. Every 6 months, self-advocates and families are invited to meet members, and the local family networks are given the opportunity to present what they find helpful about their workers and what they're looking for. This helps inform some of the professional development and networking topics. Just Good Practice is the way to ensure good practice and peer accountability for Jane and others who work within these vulnerable demographics. Here's how we can make this happen. The initial target area would be Peterborough, Kawartha, Hastings, Haliburton, and Northumberland regions as a pilot. We would need a website that had capacity for membership areas and login and videos to be held, part-time lead position to build momentum and sustainability plan, a Zoom account, and some physical space occasionally for networking meetings. And we need to help spread the word through people like Jane and others about this project. We are applying for startup funding through the Canadian Centre for Caregiving Excellence. We're also considering applying for research funding with partners like the Canadian Centre for Caregiving Excellence, other professional associations, and People First of Canada. Other partners might include iCare and Respite Now apps, and RespiteServices.com, self-advocate groups, family support networks, developmental services system committees, respite support systems, and post-secondary education. Throughout the year, we will evaluate this project in the following ways. We will track the number of members and the engagement in meetings and how often they accessed professional development modules. Through collaborative feedback from the membership by self-report and self-reflection about the impact of belonging and their sense of isolation, professional development and leadership, and feedback from self-advocates and friendly networks about retention and increased quality of services and supports. After we have evaluated the project, Jane will help us present what we have learned to other interested areas of Ontario. Through sustainable funding, ongoing collaborative evaluation, and your help, we can increase the quality of services and decrease professional isolation for people like Jane and other private support workers. After all, it's just good practice.
Created using Powtoon.